Welcome to the Nurse Wellness Podcast, Dr. D. I'm so excited to have you here.
Thank you so much, Wendy. It's my pleasure to be here with you.
Yes, let's start off by you telling us a little bit about yourself.
Sure. So I go by Dr. D because there's always a little funny story to everything, right? Like, why Dr. D? Well, it's funny because all three of my names start with a D, right? So, and I know that my first name sometimes is a little difficult to pronounce. So I thought something quick and easy that folks would recognize would be Dr. D, and it stuck. So my whole name, my whole government is Daihnia Dunkley. Yes, my parents did that to me. Okay. But I've been a nurse for 20 years and an RN for going on 18 of those 20 years. Started off as an LPN. And my background in nursing is in maternal-child health, and then transitioned into more leadership roles. And now I've transitioned to full-time being in academia, but I also am an entrepreneur. So I have two entrepreneurial ventures, one on the nonprofit side and one for-profit. But in a nutshell, who I am as a professional, as an individual, there are a few things that if you know me, then you know I'm going to talk about them. All right. One is empowering Black women, especially in the maternal health space, right? And also advocating for more minority representation and diversity in all professions. But since I'm a nurse, I'm advocating for that in the nursing profession. So that's in a nutshell a little bit about me. Couple of fun and personal things. I live in New York, and I have a little Shih Tzu and Lhasa Apso mix puppy, who is always the one making all the noise in my background. In this Zoom day and age, I can't control him. He's running all over the place. So if you hear a few noises, it's the baby. And I'm originally born and raised in Jamaica and immigrated to the States as a child. But I'm going to stop rambling now because I'm sure you have other stuff you want to talk about.
Yeah, so you are really focusing on two really important areas in healthcare, right? Maternal health, Black maternal health is a thing. The disparities that lie there, we can have a whole series on that. But also, Black nurses in leadership positions feeling empowered. So tell me a little bit about how you got into that. What made you say, I want to focus in on here and make a difference in this sector in terms of, Black nurses being in leadership positions?
Yeah, absolutely. I think that sometimes you make a plan and you go after what you want and what you think your vision is in life. And then sometimes stuff just finds you. And then it all kind of just comes together eventually. I always knew as a kid, I wanted to be a physician. I wanted to be an OBGYN initially, right? So maternal health was something that was always an interest. It turns out that professionally I became a nurse, but I still pursued that maternal health piece. And that's just something I think was a calling, right? Working with moms and babies always intrigued me. I was always that kid watching all the, baby stories, and, I was just fascinated by the pregnancy and childbirth process. And so my personal passion for that, and kind of intertwined with my career choice, the leadership piece kind of came in by happenstance. I didn't plan it that way. One of my previous directors of nursing, I wanted to go straight into education after I finished my master's, and she was like, no, I know that's what you want, but I have this role and I think you'd be a good fit. And she kind of gave me my start in leadership. And so that, being that I was already in maternal health, I, now was represented as leadership within that space, right? So the two, kept, it's the synergy, right? They just kept intertwining. But I will tell you, I think I spoke to another colleague about this week, is that although I was working in that field, wasn't quite aware of the severity of all of the inequities and disparities that we were facing. You'd hear anecdotes about, what would happen at other facilities, and just bits and sound bites here and there. I, back then wasn't really into the literature as I am now. But something, one of the pivotal moments in my career was when I actually, in one of my leadership roles, experienced a maternal loss in the facility where I was working. And I think that something about that experience, when it hits home, when it's in your face, when it's in your yard, and you can really touch it and feel it and experience it. And when I say experience it, I mean, I was in the thick of it, holding family members who were distraught, trying to keep my staff together, trying to keep my own composure, right? Something like that doesn't leave you. And I said, well, if I'm going to be working in this field, I have to use my knowledge and experience to try to make a difference, right? And it can't just be business as usual. And so that's kind of what lit the spark for my advocacy efforts in both spaces. One, because I know that now I became aware of the issues with the maternal health outcomes. But the other thing is, working as a leader in that space, as a minority, you realize how few of us there are. And so those two things have really been fueling my passion.
Yeah, you brought up a really good point about, mentorship, someone saying, Dr. D, look at this opportunity. Mm-hmm. And that was like the start of everything. Yes. I think mentorship is so important. And I think people don't give it enough significance, mm-hmm. just in personal and professional development. So I think that was pivotal for you, right?
Absolutely.
In what you're doing now.
Yeah, I think mentorship is absolutely foundational to achieving any level of maturity and success professionally. You have to have someone who knows a little bit more than you, to just be quite frank, right? Who's maybe experienced and been where you're trying to go. That insight is so precious. It can save you from major pitfalls and mistakes, right? And yes, we're going to learn by our own trial and error. If you have somebody who can help guide you and say, no, don't step over there, it's so helpful. And also, I consider this person that I mentioned before as a sponsor, right? Because I, didn't necessarily have to pursue the role, right? She kind of just spoke it up for me, right? She created the pathway for me to step into this position. And so I think it's really, really key. And it's one of the things that I teach, is that you have to build relationships with people who can open doors that maybe you wouldn't otherwise be able to open, right? That's really,
I'm glad you said that your sponsor opposed to your advisor or yes. your mentor. So I love that.
Different, right? They're certainly different. I think this person was more so like, she saw something in me. She thought I'd be a good fit, and she advocated for me to get to where I needed, from point A to point B, as opposed to a mentor where they'll help kind of guide you into becoming your best self, right? Whatever that looks like, because they've had that lived experience, right? And so that's more supportive.
Mm-hmm. Yeah. And I think, in terms of, sponsorship, someone being your sponsor, it's always like, you want to do your best. So networking, doing your best, showing up, and also taking opportunities, because you didn't have to step into that. You can say, absolutely not, I'm not ready. So it's definitely, having those individuals that can see the picture outside the frame, because sometimes we're in the picture, we don't know what's going on, right?
Yes. Which is why those two roles are so key, because the mentor sometimes can see from 1,000-foot view what you can't, right? Because they've just, had the experience longer. You said something, oh man, risk, right? the opportunities can present themselves, but if you don't go after it, there's always going to be an element of risk and maybe even some fear and anxiety involved in pursuing your calling, your passion, another career move, whatever it is. But that risk is kind of what grounds you as a human being, right? That fear, but you can't allow it to overtake or overshadow your desire to move on to the next level or to pursue this new thing, whatever the thing is, right? It's with everything in life that you want, there's going to be a level of risk to it, but you kind of just have to say to yourself, I want this more than I am afraid of it. So do it afraid.
Absolutely. If you're not afraid,
yes,
you're doing something wrong.
Exactly.
You a little, not sure, but yeah.
That's healthy, right?
Yeah. And that's where the mentor comes in, right? To help you through that, right?
Yes.
So
and the more advice and guidance you can get through, you can get through it, right?
Absolutely. So tell us a little bit about how you're helping women of color out there become leaders.
Sure.
Yeah.
So I have, like I mentioned, a nonprofit organization called the League of Extraordinary Black Nurses, which was founded on the premise of leadership, scholarship, and mentorship. Those are 3 guiding principles. I think those are 3 key areas where, as Black nurses, we may not get the most support. And so we offer educational opportunities, workshops, a mentorship program. We had our first Nurses Week scholarship celebration in 2021, where we gave away 2 scholarships, small scholarships, but still, those books cost a lot to some nursing students. And also gave some awards to recognize the efforts of Black nurses, and sometimes our achievements aren't celebrated enough. So that's one way that I've been helping in that space. But my other business, my consulting business, is I've been doing coaching, one-to-one individual career coaching. And I also created a signature curriculum called the Seacole Effect. And is it okay if I talk a little bit about what that is?
Absolutely. I want to know more. I want to know everything about it.
Okay, awesome. So the Seacole Effect was born out of my dissertation research, my doctoral dissertation research, which was a study on what it is like while becoming a CNO, being Black and female. So I interviewed 10 CNOs at the time, all Black, all female, and they talked about their lived experiences, right? How did they get there, right? We know that that role is severely underrepresented as it relates to Black nurses, but they were able to achieve that level of success. So they had to have some kind of code book or something that, insight that they could share with us. So the results of that study helped to inform this curriculum that I developed for the Seacole Effect. It is called the Seacole Effect. It's named for our pioneering Black nurse, Mary Seacole, who doesn't get the same attention that as Florence Nightingale, who incidentally, they were they're honored now for their efforts during the same war, the Crimean War. But her name wasn't highlighted for many obvious reasons, right? But she was one who was trained as a nurse through a familial traditional medicine and healing practices. And prior to the Crimean War, she had already traveled all around the world, the Caribbean, South America, helping with various disease outbreaks. So this was someone experienced and knowledgeable. She asked if she could participate in the Crimean War efforts as a nurse, right, alongside Miss Nightingale, but she was denied that opportunity. And so she created something else for herself, right? She created a hospital or like a hotel to convalesce wounded soldiers from that war. And that is what she's recognized most for now. But in that same spirit of defiance and resilience and just saying, okay, well, if you're going to close this door to me, that doesn't mean that my passion and my calling as a leader in this space goes to waste. I'm going to create my own space, right? And that ever since I learned of her story, which I didn't come to know till many, 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 many years into my nursing career, even as a Black woman, even as a Jamaican nurse, I didn't know about her. And so once I did, I was like, okay, no, I'm obsessed. And now everybody else also needs to be obsessed with me and know her story. So that's the combination. It's a result of my research where I took the results and created a curriculum to inform and develop and support minority nurse leaders, because it's a little different when other leaders don't look like you. Your lived experience might be a little bit different in that space. And I wanted them to be prepared. I want them to have strategies for success from other people who have done it, right? And their best practices. So that's what the curriculum is about. And now I just launched a new version of it. It used to be a 3-hour masterclass, but every time I taught it, I realized there's so much more I need to cover that I can't fit into this small time. So I've expanded it now into a group coaching format and currently accepting registrants for the first cohort of that.
And how long is the program now?
So the program in its new version will be 8 group coaching sessions spread out over the course of 4 months. And each session will be roughly about 90 minutes. And there'll be a topic of focus for the sessions, but registrants will also get one coaching session individually with me. They'll also get access to a private online community where additional things will be offered in that group outside of those 8 sessions, those 8 groups of coaching sessions. So they'll get other content and support from other experts in the field as well. And so that's a brief description of how the program would run.
Yeah, I think that's awesome. That community piece is so important. So important. And I'm glad that you built it out because, 3 hours is definitely not enough, especially if you're looking for sustainable change or you're looking for transformation. And Mary Seacole just sounds like an amazing woman who blazed her own trail. So it's only right that you're helping other Black nurses blaze their own trail in leadership.
Yes.
So I want to ask you, Mary Seacole and yourself, what are some parallels? Or do you see any parallels like from, her life experience to yours?
I definitely do see some, right? Besides the obvious, being Black nurses, being Jamaican, of the Jamaican descent. I think just her, I've always been told, so my mom used to always tell me, my child, when you want something, you're like a dog with a bone, like by any means necessary, you're gonna get it done. Either you're gonna get it done or you're gonna get it, find a way to get it. And I think I do see that parallel with her. It's like, she knew she had a calling, she knew she had a purpose, she could be helpful, right? And just because she was denied by those who were in the seat of power, didn't mean that negated her purpose, right? So I'm gonna find another way to do it. And so I think that's what I'm seeing develop in myself now, as starting 2 businesses in a pandemic, having to pivot, and go and actually just started another business venture that I opened up access to another talent that was kind of laying dormant. It's just, I see many similarities with the way that she did what she did, defying the odds, not listening to what anybody has to say, not waiting for the right and perfect moment, right? Because she could have said, okay, well, I'll just apply for the next war. So, I'm being flippant, but she was like, no, this is the one, I'm going, right? And so sometimes we try to wait for the best conditions, the best conditions in our mind, to start something. And I've, at least within the past couple of years, just said to myself, you know what, if I have the vision and I have the wherewithal to make it happen, even if I don't have the complete package together, if it's something that I'm purposed to do, I'm just gonna take a step out on faith and do it. Yes.
You said my word, purpose. And it's
Yes.
really like an imperfect action. As long as you're, and I say this all the time, people are probably tired of me saying this, but as long as you're aligned with your purpose, things will flourish. And you're doing it for your intention is pure. You want to help. You're really filling a huge gap there. But your intentions are pure, so you're definitely going to see your way. I wanted to kind of go back, and you said a talent that's dormant. Is this something else in addition to what you already told us about?
So, okay, so sure, we can tap into that for a moment.
Yes, I want to know everything. Yes.
So, what's the saying that necessity is the mother of invention or something like that? So when I started my businesses, of course, you don't always have the biggest budget to start from, right? And, I had hired a coach, the person to build the website and to do, some visual promo graphics and stuff. And then, as time went on, I realized, okay, I'm going to need some more graphics, I'm going to need some more advertising materials. And, the waiting process, the person I use is excellent, and I still use her. I'm one of her VIP clients, so she's never getting rid of me. But in those in-between moments, right, I realized, okay, I'm gonna have to help myself a little bit because I can't afford to keep, and paying. And I started doing them myself. I started doing my own visual graphics for my social media posts, and for my email blasts and anything visually related to the businesses. And I taught myself how to do them, and I was like, I like this. This is actually fun for me, right? It's something that was born out of a need to be resourceful, but I actually find it, I use the word therapeutic. I absolutely, when I'm in my zone creating something, it just, I don't know, something just came out of me in that space. And so this year, people always compliment me on the graphics that I use to promote my business. And I was like, well, this could be its own business. And when I tell you, it hasn't been like 2 weeks, and I've already gotten so much feedback and clients, pouring in. I just signed my first retainer yesterday where they'll keep me on, for a year, and I give them whatever they need, and I was like, nobody's gonna book this.
Yes, they will.
In comparison to people who have gone to school for this stuff. Right? I definitely would never take their credit away. I still can't do all the stuff that my person that I use can do. I will probably never get to that level, right? Or I'll be behind. But when I tell you the support and the encouragement that it gave me to see people are actually willing to invest in this is what I'm saying. Is like, you can't wait to, what if I would have said, I need to take a couple more courses and become more credible first before I'd start doing this, right? And for the person who does that, that's great, because you should always want to expand your knowledge base and hone your craft, which I also will do. But I didn't have to, I decided not to wait, and the blessings are already starting to pour in. So sometimes you just have to take that first step and just put it out there. And the other part of that was, I struggled with, well, this has nothing to do with nursing or healthcare, but it's another part of who I am. Yeah. And I don't have to limit myself to just who I am professionally if I have other gifts and talents that could help other people.
Yes, absolutely. Absolutely. I mean, like you said, we're not just nurses. There's so many more entities to us as individuals. We're individuals first. Nursing is just part of the pie. It's not the pie. Piece of the pie, slice of the pie. I want to kind of go back, and your graphics are beautiful, by the way.
Thank you.
They're gorgeous. If you guys have not seen them, you have to follow her. We'll definitely get her information at the end. I want to go back to the Seacole effect.
Sure.
That course you have. What do you think institutions can do, or corporate sectors can do to increase the amount of Black and Brown people in the space? So in nursing and nursing leadership and C-suites, what are some things that, you know, people can think about implementing into their current institutions?
Absolutely. I think starting internally, just to do a temperature check on where you are, right? One, do you have the representation, right? Does the mix of your employees, even throughout all levels of the hospital, but in particular, we're discussing leadership right now, does your leadership team reflect the population that you're serving, right? Let's start there. But if it doesn't, why, right? You kind of have to do a needs analysis first in order to address or strategize, right, for improvement. And so if the leaders, also you have to take a temperature check on the leaders that you do have, right? The diverse or minority leaders that you do have. Do you feel supported? You know, what can we do as an organization to make you feel a sense of belonging, right? Not just that you work here and you check a box because you're a minority, but do you feel that you belong here? Do you feel your ideas are valued? What can we do to support you, to develop you, right? Are there opportunities for growth that you've identified for yourself that we can assist you to achieve, right? And having those difficult conversations about how, if you do have an underrepresentation problem, which you probably do, then how can we make this environment more inclusive for you, right? And then there are all the other aspects in terms of, and this is going to take years to try to chip at this, and we're making leeway because we're making strides towards it because other professional organizations have identified it and made it priority in terms of the pipeline, right? So I'm currently in full-time academia, and I'm not seeing the applications coming in for minorities as much as I would like. Right, so there's an issue there that I just had this conversation with a colleague. Why aren't we getting more applicants from the front end into the profession, right? To then be at the bedside, to have more representation at the bedside, but also to then develop them to become tomorrow's leaders. And so we have to kind of look at that as well outside of your own individual organization. And also I touched on developing leaders at the bedside. Everybody is not going to be in a leadership position. But how can we also develop the leadership mindset in the role as a staff nurse amongst your staff, right? As an institution. And so I think those are some of the areas, partnering with community organizations as well, right? And also our professional membership organizations and governing bodies. We all have to, you know, we may not come up with one perfect plan, but all have to be doing something that's not just performative, but is, like you said, something you said about the ongoing, the maintenance of it, right? It can't be a one and done. This has to be a daily commitment over and over again, checking it, rechecking it, you know, planning all over again and implementing music. It has to be an ongoing cycle, because the more attention that we give to it, right, the more that we'll see the generational change that we'd like to achieve.
I think that is totally spot on, that pipeline. That pipeline. But I also think for Black nurses as well, we have to feel empowered too. To start the conversation, right? Because you may have a leader who has the title, but not really the true ability to lead. So you
Yes.
don't want to put your career development in the hands of that person.
Oh, I'm so happy you said that. Yes,
Come on,
I
talk to
totally
me a
agree.
little bit about that. Talk to me a little bit
Totally
about that.
agree. You have to be inspired as within your own individual self, right? You have to become like that dog with the bone. You do. Because sometimes you'll find a great leader who will invest in your growth and development. And I've been blessed throughout my career to have several that pour into me. But sometimes you have to seek it for yourself. And even in my research, that's one of the findings, right? Time and time again, each of these leaders would say to me, there weren't opportunities for growth provided by their organizations. And they had to make an investment. They had to pay for a personal coach, right? To learn how to do public speaking. They had to reach out to their networks and find mentors. And mentors outside of nursing to help cultivate them as well-rounded leaders, right? The business aspect is not something we focus on in a clinical profession, right? But as a nurse leader, you're going to have to learn how to manage resources, how to do a budget, right? Those types of things. So, reaching out to somebody in finance, to mentor you, learning what you even need. You're like, what do I need to know? So sometimes you have to seek those answers for yourself and go to conferences and read the literature, right? The subscriptions that you get to the journals of your professional organization, read them, find out what's going on in the landscape of nursing, right? There's so much that you can do for yourself as well, right? But you have to have a sense of internal motivation and the right mindset that goes with that.
You have to invest in yourself. We
Yes.
have to invest in ourselves, and not just financially. Yes, you need financial investment too, but you have to invest your time, your knowledge. It's continuous. I have two questions. One is, do you work with organizations in terms of looking at, their landscape, doing an analysis and helping them develop a plan to maybe increase the number of Black and Brown nurses in their organization?
That is something, I have something coming up, right? So that is the space that I'm trying to infiltrate. Other than the one-to-one coaching and the group coaching that I do want to get into more organizational efforts to help improve these things. I can't say much about it right now, but I'm in talks with an organization to help create some leadership development programming. So absolutely would love to work with an organization, a hospital or hospital system, to try to strategize with them and do like I said, the needs assessment about what's going on within the organizations to help them improve their outcomes. So absolutely.
Yeah, I even envision an organization, a hospital, enrolling some nurses into your Seacole effect.
Oh, yes.
And then even seeing the trajectory right after that to even, you know what I mean? So I think, leaders who are listening, if you are in a healthcare space and you have nurses who you think would, be a good fit for, this program, I think it will be a good pilot even, to really see the trajectory on the other end of that. I think that would be amazing. That's how I envision it.
I would love that. And I had the same vision too, because on the site, it says that, if you're interested as an organization to do, a special cohort for your nurses, or it doesn't even have to be a separate cohort. If you want to sponsor a nurse to join the current cohort that I'm getting ready to have, either way. And I totally agree with you there, Wendy.
Yeah. And how can they get in contact with you? We didn't mention that.
Sure. So I tried to make it easy. You can just go to the website. Everything that you need to know to contact me is there. You can directly send me an email from there. You can book an appointment with me from there. The website is www.iamdrd.com. Doctor is spelled all the way out, and D is just the initial. So iamdrd.com. There's a whole page dedicated to the Seacole effect, booking instructions, how to get in contact with me. It's all there.
All right, I have one more question for you before we get to our rapid fire and wrap up this wonderful discussion. I'll definitely have you back. What is one thing you would tell a Black nurse who's listening to this right now, who's just feeling defeated and like she can't really contribute to anything because, you know, we're in the midst of COVID, stress levels are high, there's so much going on. What's one piece of advice you can give this one listener who may be listening right now?
Well, first I would say, don't feel defeated. As a nurse, just your degree alone, your training alone has prepared you to just be such a dynamic individual. Not only are you able to care for the health of others, right, but we're caregivers in every sense of the word, right? We're uniquely skilled and have the knowledge to affect the health of not only individuals, but communities, right? And if you're feeling defeated, right, start where you are, right? Start with who's around you. What are you passionate about? And how can you make a difference in just, you know, your nucleus of folks around you? It's no coincidence that nursing has been voted the most trusted profession for all these many years in a row consecutively. People love nurses, right? So if you have that credential, you are already a cut above, right? There's so much in you, not just through your training. The training is the icing on the cake, right? But you as a person individually have so much to offer. When you add that nursing training to it, boy, there's nothing, we can do so much. We can do, so you have to recognize the power that you hold just by holding that title of nurse. There's so much that you can do. And if you're feeling defeated, you know, like, what can I as an individual do? There's so much going on around me. There's no possible way I can make a difference. That's not true. You can influence the people right in your circle, and that will have a ripple effect, right? I'll give you an example. When the Biden administration had chosen the folks who were going to be a part of the COVID task force, which, where are they, by the way? Anyway, that's a whole nother side conversation. Have you heard me? You know, but there was no nurse. I mean, the nerve. How can you impact systems at a healthcare, a pandemic, right? Something that affects health and healthcare for the entire globe, and you didn't include the largest part of the healthcare workforce? Like, come on. So I was infuriated, just like probably many other nurses. And I was just like, I don't know, what can I do about this? I'm just one person. I'm sure there are other people that feel like me. And then the light bulb went off. I was like, that's it. You just have to connect with one other person who's like-minded, and another person, and there's a ripple effect. And I started a petition. There were others, right? I'm not the only one that started a petition, but you see, like, the collective effort of just one person saying, let me start this, just start where you are and in your nucleus, it will ripple out. And even if you just touch one person, you've already made a difference.
Absolutely. And then while you were saying that, I wanted to say, people always talk about social media. I met you on social media.
Yeah.
So social media is so powerful if you utilize it to your advantage. Absolutely. Not just going on, just looking and seeing, but really engage and tap into the people who are like-minded, who's on the same plane as you, you know? So very powerful during this time. I was never on social media until the pandemic hit, and it changed my whole world.
Absolutely.
My whole world. So go ahead.
I was just going to say, as my colleague Arnice Williams, she's your nurse lawyer on Instagram, would say, y'all got to get on LinkedIn. Okay. That is untapped. I'm telling you, I've made so many connections on LinkedIn. If you're talking about professional networking, get with it.
Keyword, connection.
Connection.
Connection is the key word. Reach out to somebody today.
Yes.
That's
Yes.
your nugget. Reach out to someone today and visit Dr. D's website.
Yes.
So before we go, I just want to take your rapid fire. Is that okay?
Sure.
All right. So let me know the first thing that comes to your mind to answer these questions or finish the phrase.
Okay.
Wellness means?
Whole. That's what I hear when you said wellness, I think of being whole, right? Embracing all of who you are.
Yes, that's a good one.
And then taking the steps to make sure that you're whole. Yeah.
Yes. I know I'm stressed when?
Ooh, when I can't sleep.
Yes. And I guess your go-to stress management solution is?
Traveling.
Yeah, you were in Africa? Where did you go? You went somewhere recently.
So there was supposed to be a trip scheduled to Africa. With everything going on with Omicron and everything, we weren't able to go through with it, but I am an avid traveler. I will book a ticket in a second. I love to, it's something about getting out of your own space and seeing other parts of the world, how people live. And even if you're just not doing anything, but just laying on a beach somewhere to de-stress, decompress. I love to travel.
Sounds good to me.
Mm-hmm.
The last time I had a belly laugh was?
Oh my goodness. It had to be, you know what? Every day I find something to laugh with a friend. You gotta find, I can't really pinpoint it. It's often. It is often. Good. Because I'm a person in my personal life, I try not to take myself too seriously. So my friends and I are always, if you look through my phone, it's always a meme or a post or something, somebody, to just make it through the day. You just have to find reasons, purposefully find reasons to laugh.
Absolutely. The last book I read was?
Oh boy. I gotta find the title. Let me tell you about it. Sorry, I can't remember the title. Let me find it for you. Well, probably the last book I was reading was a maternity textbook, but that's not fun. That's not fun. Or some research article. Where's my books app? So sorry. I'm gonna find it for you. Books. I just started it. It's called How the Word is Passed by Clint Smith. And it's basically talking about the history of slavery and how its affects in America, how the word is passed. Yeah.
Oh, that sounds like a really interesting book.
Mm-hmm. I'm about one chapter in so far, but it's good. It's very good.
I'll have to check that out.
Mm-hmm.
And my last question is, one thing I learned about myself during the pandemic is?
Don't put things off. Take advantage of every moment, live fully in every moment, no regrets. Show people how you feel about them when you can.
Yes,
every
absolutely.
chance that you can. Mm-hmm.
Absolutely. Well, thank you so much for being here. This was great, and we will definitely have to have you back.
Thank you so much. This was fun. I could talk to you all day.
Yeah.
I'm mad it's taking us this long to actually sit down and do it, but I'm so comfortable. I'm like, let's go. So anytime, I'll be happy to come back.
Awesome. Thank you so much.
You're welcome.